I mean, yes, we have people who there with them and another, but gosh, damn parking lots, guy yard, something. Not that I know about these things. Cap. Hey guys, welcome back to my channel, and thank you so much for tuning into this week's video. If you're new here, don't forget to subscribe. I am Amilas. I do nursing videos, challenges, vlogs, and videos like this one here. And if you've been here from day one, big up yourself. So before I get into the video, I know that first years are expecting what to expect in your second semester of nursing school video. However, because it took so long for me to put that out, I'm wondering if it actually makes sense. So I am thinking about doing a review of each course, like AMP2 review, health assessment review, and so on, instead of a what to expect, right? So let me know if you would be interested in watching something like that in the comments down below. Now, as you can tell by the title, I'll be reacting to some videos. I've never watched Grey's Anatomy before, never. I just like see the memes, so I don't really know what to expect. I'm gonna be watching it on my tablet and putting it on my screen. So I have a long list of them, and I'm just gonna click on one of the links. So let me start the screen recording, and then let's get into the video. So I'm not really keen on the whole editing thing, so what I'm gonna do is I'm gonna watch the video first. Y'all gonna watch it with me, and then I'm gonna make my comments after. So I think that's better. So I'm gonna start the recording in 3, 2, 1. Grab some popcorn. A Sunday, we're not supposed to cook. Let's go.
Dr. Sloan?
Dr. Gray. After you, Dr. Gray.
Thank you, Dr. Sloan.
Don't even tell me. What? People sleeping, or what about this?
This is ridiculous. I need sleep.
That's not a good noise.
That's a bad noise.
That's a really bad noise.
Oh my God, are you okay?
No!
It's bent in the middle. I think I broke it.
Get Taurus! Go! Yep, that's a penile fracture. Oh, I'm gonna kill myself. We should operate and then you can kill yourself. Oh, God.
Can you do it?
Him? No. He's a meatballer.
He is meticulous, and he will keep his mouth shut.
I've done operations like this before. It's not that complicated. Guys running into this problem on the battlefield, do they? I think you and I should talk about how guys run into this. Line up an OR. We need to get in fast, or you risk permanent damage.
Oh, God, no permanent damage, please.
Hey.
Little Gray. Go away. I don't want you to see me like this.
I made you like this.
I'm saying please here. Please.
Hey.
Things go away.
No,
Little Gray.
it's not Little Gray. It's Lexi. And I'm sorry that I broke. I'm sorry that I hurt you, and I'm sorry that you're humiliated. But I'm not going anywhere. I've got a friend who is guarding the door, a good friend, and since no one is going to be coming in, I'm now going to climb into bed with you, and I'm going to stroke your hair, because that's what I like to have done for me when I'm hurt.
Oh, that you done? Alright, ladies and gentlemen, there you have it. The first clip. Now, yes, first of all, first comment, that not gonna go on pan work. You know which nasty classes? First of all, there's nothing that private there, and the door already there can easily push open. And even if you're brave enough to do it at night, that's a whole lot of germs and stuff. And oh, that's a one thing. I don't think people do that. I don't know. I don't know. But secondly, I mean, yes, we have people who there with them and other, but gosh, government parking lot, guy yard, something. Not that I know about these things. Cap. So yes, penile fracture. Penile fracture. Let's Google it. Yes, penis gangrene fracture. So let's Google. So, a penile fracture is a tear in the tunica album. So, again, it's a tear in the tunica. Now, the tunica is the rubbery sheet of tissue below the skin that allows the penis to increase in width and length to produce a firm erection. Sometimes the erection tissue beneath the tunica also ruptures. This is also that's known as the corpus callosum. So that's a definition of penile fracture. Let's see the management. You know, as nurses and prospective nurses, so we would be, if we get one patient like this, first thing you notice that that person would be in tremendous amount of pain, because you know it's very embarrassing, and you're gonna have to go there and collect the history and all that. You're gonna ask questions like, what is the cause of this? You want to know what happened, you want to know what broke it, and most times they might lie and say they fell or something like that, especially that are attracted to the other gender, the same gender. I mean, yes, a lot of them have this. I've only seen penile fracture once, and it was by accident. They know I was at SOG, and then they just sent me to do something and put me on the ward, and a doctor asked me if he come for something, and I saw it, and it does not look pleasant at all, ladies and gentlemen. As much as so we always say man wicked, me not think they deserve something like that. So the trauma is most often caused by sexual intercourse, such as when the penis slips out of the vagina and is accidentally thrust against the pelvis. I feel like me are broken out with this information, but this is on Grey's Anatomy. I didn't know. So let's find out about the management. But if it's a fracture, you know, like if you do first aid, you know how you treat fracture. But I am not sure if it's the same way you would treat that. You're not gonna put one splint for our penis. So let's see what Google says. So current treatment recommendations are for immediate surgical repair. Let's go more in depth into the treatment. I'm kind of interested now. I know someone interested too. So the surgeon will use stitches to close the tear in the tunica. So remember I said at the part the tear. Remember initially in the definition you said the tunica and the corpus callosum tears, so they must stitch you up. So the main goal of treatment are to restore or maintain your ability to have erections and preserve urinary function. So again, as nursing students, these are things that we would have to explain also to the patient, that you know, once they sign off to the surgery, in the event that it doesn't go well, side effects or complications are that one, you may never have an erection again. Two, you may be peeing in a pee-pee bag all your life. Be careful. So let's go on to the next clip. I'm gonna do two. It's a new series that I'm starting, Nurse Reacts. This will be accompanied by most of my classmates. Hopefully this week, next week, I'll be able to get some of them because our schedules are mad busy. So I'm gonna watch the entire clip first, and then and then we'll be able to just comment after, right?
Hey, kid! Kid! You okay? You need to come with me. Okay?
Just like before. Start a central line, but you have to get out of the way.
We put 3 milligram of epididymitis.
Derek.
This was 3 months ago. We should push up or get out. We should push this. Fine. Atropine. I think I saw some reactivity in her pupils before the atropine, and I think she might have actually had some cardiac.
Shepard, get out!
We need next round. Just leave.
We need to save her life. You can't do this. We need to do this. Now go.
So that I don't know the characters, as I said, I'd never watched it before, so if me trigger anybody, so I'm really sorry, but I caught the name of the guy, Derek. So first things first, right? The lady come out of the water, she was extremely blue, and that's something that you look for when someone is not getting enough oxygen in the body, right? That's one. So you know, if someone is drowning or near drown, that's a near drown experience. I don't think she did then. I don't know. I know what you were like. The first thing you would do, people, you need to check the airway. You know, we never see them if them check if not in our mouth, because even if you start CPR, if something is caught in between the airway, no make no sense. She can't go breathe, right? No ear not go in, right? 2, that's a 1. 2. Secondly, I didn't see him check any pulse or respiration, even though there wasn't any need for, because she was pretty blue, and they can obviously she did a drown, or she almost dead, or she about to dead, or she dead. Alright, but normally, guys, CPR, you know, you check your pulse, you check your the breathing, right? So you know which one to give. Thirdly, he was doing chest compression. He was doing it right, but it is 30, so 30 at this. We do it to the song, ha 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 ha, stay alive, and by the reach, stay alive, at the time we give the breath. So 30 at least and 2 breaths. That's how you do proper CPR. I'm not sure if there's a different way for emergency cases, so if there is, nobody come for me, because me just don't know. I'm just commenting based on the knowledge that I have. So 30 compression and 2 breaths. Fourthly, something that I picked up, the ambulance driver named her Jane Doe. I guess then just said that to identify that she's a female, and they don't know her. But the black girl never come in and say how long. That's a very good question, because if I like 1.5 an hour, so chances are people, she probably dead. So moving on to the part where she went in, and you notice that they did not stop the compression. That was really commendable. You don't want to stop that, because basically when you stop it, you just have to go start over again. They gave her epinephrine. I know epinephrine, people, is like adrenaline. You know that there's something that make you fly over places. Yeah, so it increases the heart rate. I'm not sure how does that help in drowning case, so let's Google it. So it says it increases myocardial and cerebral blood flow during CPR. So yeah, the same property, the same thing where you normally do when they get epinephrine, increase the blood flow, make your heart start pump up more, and all them stuff. So that was a very sad scene though. Let me move from how me transition from being in a fracture to near drowning. But that's the only thing wrong that I see. By the way, how do you guys feel about me doing an episode of first aid videos? So let me know. So that's the end of the video. I just watched 2 clips per video, per reaction video. So let me know if you've enjoyed the series. Well, it's new. Let me know how you feel about it, if I should continue or not, in the comments down below. I have a lab class this week, so I'll be definitely doing a week in my life, or a day in my life rather. We'll be doing venipuncture, so that's kind of exciting. So thank you so much for watching my video. Don't forget to like, share, comment and subscribe.